one-stop shop, if you like, so people know exactly where to go and talk to people, exactly who is there to help, and to have a high visibility, both internally for you, but also externally, so that people are aware of what we're doing in the region. And that's been very successful. There's a very high level of awareness of the innovations and the things that we've done. And as we'll hear a little bit later, it's been an astonishing year of success for the Academy and for the people linked to it, with something like an 80% success rate for applications, which is kind of off the scale. So what we thought it would be useful to do today was just to update people a little bit, to remind everyone what we do and why we're doing it, and just spread the message. So it's very informal. I'm going to talk a little bit, then Amy's going to talk about the Fellows Forum, and then I think hopefully Nina knows she's going to talk about our successes, but she didn't get the memo. I can do that at the end. I hope you like the images. When we do meetings, we increasingly have artists come along and capture the essence of meetings. Those of you who know me know I despise meeting minutes and things like that. And it's a visual conceptualization of what we do. And these images, those of you who come to our Academy offices, 4th floor, the Ridley building, the coffee machine is always running and anybody's always welcome. You'll see a lot of these images, and we think they're really powerful because they sort of explain what we're about in a very visual way. So we thought rather than boring slides, we would use some of these images. So that's the reason behind them. So there are certain themes with all of this. The first is, the big word here is region. So we are about the Northeast, and essentially we work with all of the organisations who are interested in supporting career development for people in the region, in the medicine, dentistry, health related research area. So, and the reason we take a regional focus is because in many ways our principal funder is NIHR, because of the breadth of their funding. They cover the region, their professional spectrum covers the region, and obviously we have a strong link in with undergraduate education in medicine, dentistry, applied health research, allied health professions, where there is a sort of strong university focus across the region. So we work with other universities, and we do a lot of work with Sunderland as they set up their new medical school academic program. That's been very successful. We obviously have very close links with Northumbria University around the nursing, midwifery, allied health professions. So everyone is welcome. Why NHIP Academy? Well, Newcastle Health Innovation Partners is obviously our host structure that funds the people who are there to help you, but it won't have escaped your notice that it's an abbreviation of 4 letters that sounds a little like NIHR, starts with an N and includes an I, and the NIHR Academy is a key funder that supports many of the people on this call, and will be a target funder for lots of other people. So if this looks, sounds and feels like a kind of building on the vision of the NIHR Academy, that's entirely non-coincidental, and I was involved in setting the NIHR Academy up. Why an academy? Well, actually, we chose the word for NIHR because it's a coming together of people interested in academic endeavour. It's a community of expertise and interest, and that's very deliberate. That's what we're trying to do here, make this a community that essentially looks after itself and supports itself. And a number of the things that we've talked about the role of people, you know, further on the pathway, helping other people, is a really important part of what we do. So academy was very carefully chosen as a word. Okay. So we work as a partnership across the region. I said that's very important, but we also work across the spectrum of organisations, universities, obviously, NHS organisations and other healthcare, so the hospital trusts, obviously, but we also work, for example, with St Oswald's in palliative care as an important area, and obviously increasingly with the other structures, primary care and so on. So it is healthcare organisations in general. And then one of the things that's distinctive about the Northeast, actually, is the involvement of local authorities, councils in the academic endeavour. Newcastle Health Innovation partners with Newcastle City Council. Other councils in the region are also very research active around the public health and social care space, and that really gives us a unique dimension. And I'm sure there'll be people on this call who are linked into that local government, public health, social care, health inequalities nexus. So the council is a very important part of this, and actually that spectrum of organisations is pretty much unique in this space. So it's genuinely cross organisation and genuinely across the region, and partnership are the two key words. And what we're here to do is help you navigate your path from where you are now to where you want to go to, and it's as simple as that. Okay, next one. Pardon me, terrible hiccups. That's the mistake of the coffee. Another good word for what we do is inclusive. And when we set this up, we very, very, very deliberately set it up with 4 pillars. And those pillars are equal in terms of our effort and our aspirations, and those reflect the different professional groupings. So that is medics and dentists, perhaps the sort of group that historically were best catered for. Nurses, midwives, allied health professionals, pharmacists, healthcare scientists. Massive expansion area in terms of NIHR funding and aspirations. So lots of new schemes and super opportunities for people in that space, and a big national priority. Research methodology, likewise, a big area of focus for NIHR. So this started in a way in statistics and health economics. It's moved out into all other methodology areas, health data science, and so on and so forth. Critical part of the ecosystem, and then public health and social care. And we only have to look at COVID and the challenges in society to understand the importance of all of that. Historically, as I said, there was a lot of investment in centres supporting medics and dentists, but others, sub-professional groups, were not supported as well. That is not what we do. We support all equally, and it's been so good to see real success in each of these areas. So these are our 4 pillars. They're all led from within the professional groups, with really high achieving academics sort of coordinating the activity, and all of them are focused on training and career development. So all of them are there to help you. It's a really important part of what they want to do. Why do we have the separate pillars? Why do we not roll everyone into one big community? Well, the answer is the schemes are different. So if you look at each of the schemes other than the medics, there are very specific fellowship opportunities in those professional groups, largely with NIHR. So, for example, in public health, there are a number of very exciting doctoral and postdoctoral schemes. And so the way to give you the best information and the best guidance about schemes in your area is to have a focus on that area. So that's the reason for doing it. There are some common schemes across all of them, but there are bespoke schemes, and those are the ones that you're really best off thinking about, because the chances of success are that much higher. So that's the reason for the 4 pillars, but it is all inclusive and it operates as one big entity. Next one. So other than, so that's my kind of overarching what we're about, what do we actually do? And what we actually do is roll our sleeves up and work hard with you on your individual application. So this is a lot of kind of overarching sort of support and enthusiasm, but it's very specific what we offer. And then the next slide is about what we want back from you. So, it's a really important part of it. So what we do is we have, I would like to think, exquisite intelligence and advice on career and training opportunities. As I mentioned, I was involved in setting up the NHIR Academy. We have a disproportionate number of panel chairs for NIHR, MRC, and other funders. We have very good links with Cancer Research UK, with Versus Arthritis, and so on. So we actually are very, very well connected. And what that does is allow us to understand and know exactly what's happening in the ecosystem. So there is no organisation, I would argue, that has better intelligence about what's out there, what panels are looking for, and what is going to be happening in the future. Okay, so that is really important. So when we offer you guidance about which particular scheme for you at this particular time, it's usually with that information to hand about, you know, the fit and the feel for it all. So that intelligence is really important. We will really help you with pulling your applications together, working with you and your direct project supervisors. Obviously, the specific research components, that's very much driven by yourselves and with your research supervisors, but it's the bit that turns a good piece of science and a nice CV into a really successful fellowship application, which is what we really do. So it is about that conversion to a fellowship, and something that we talk about all the time, the fellowship is not just a good project with a CV attached. It is so much more than that. Training programs, career to date, pitching where this all goes, what the future direction is. So we offer you a lot of support with the application, and then we will help you with the interviews. Not all of these schemes are interview based, but most of them are. And everyone who gets to interview has an equal chance in these schemes. You don't carry forward your scores from shortlisting. So it's all there to be won at interview. And we as a community offer a lot of support around that. And we also very, very particularly encourage our successful award holders to participate in interviews. So we are training the next generation of interviewers as well. So it's part of that community giving back. So please, if we do ask you as a successful award holder to be involved in interview training, please do that. It's really important and useful for you to learn the skills of that, but it's also very helpful for the people who are following on behind you. Please, 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 I'll add a few more pleases afterwards. Don't just involve us at the point at which you have an interview. Involve us right at the very beginning. The number of times in the past we were asked to kind of sort out problems at interview that could have been avoided very easily in how the application was pulled together. So if there's one take-home message from all of this, engage early so that we can guide you, so you don't create some traps that you then have to kind of dodge later on. So it isn't just interview training, it is about getting the pitch right so that you're in a very good position for the interview. Okay. These are careers, very deliberately we talk about, not fellowships. A fellowship is an award that is part of your career, but you'll come from somewhere and you want to go to somewhere else afterwards. And most of all, people can be nervous about future career opportunities, but there is a whole system from pre-doctoral to professorial level funded by the funders, where we integrate research funding and clinical career training, and also future career opportunities, working with substantive employers. We have some unique schemes around people going into permanent posts and transitioning through. So we offer that connection to guide you through all of these various different steps. So this is a pathway, and it's useful to have a sort of thought where the future lies for you, because that will be benefited by the decisions that you make if you make those decisions correctly. So we sort out with you future opportunities as well, never too early to start thinking about that. And the process for future career development is something that we think about. We work very effectively with the university, NHIP Partners, the local authority, very positive engagement around it. We have Claire McCormack from the university HR department coordinates those HR contacts so that we're getting the system working from the very beginning. So the last thing any of you want is for there to be arguments about what happens next. So we're having those discussions behind the scenes all the time. So we really do benefit from having that process. And I think there are many aspects about what we do here which I think are unique in the system, but that is probably the most unique thing, is that we've cracked some of these higher progression issues in a way that other organizations haven't. Next one. We do make an ask of you, okay? Please own this, okay? I look around at my contemporaries who went into NHS consultant roles, they've all gone and I'm still here. And the reason I'm still here is I love what I do most of the time. I love what I do. And that's because an academic side to what we do is never stale. There's always a new challenge, always a new question. There's an opportunity to pull through into real benefit. You go home at the end of the day and think you've made a real difference. So this is a wonderful career, but you have to make it happen. Ultimately, we can help you, but we can't replace your vision and energy and drive. So please do take responsibility for it. At the end of the day, it's your life and your career. We can help you, but we can't make it happen. Only you can make it happen. And you're more likely to make it happen if you work with us. Take responsibility for all of that. And take our advice. We kind of know what we're talking about with all of this. So contact us as early as possible. Work with us. Be guided by us. Okay? That's the first thing. The second thing is, this is kind of a blanket request. And it's slightly a strange one, because I think most people assume we do this anyway, is that we are required by the funders to provide information about whether these schemes work. So we're being asked all the time for both data about success rates and transitions in careers and all of that, and also stories about people's successes. And that's at a peak at the moment. Why? Because there's a spending review coming along in government. And so they want to know, do these schemes that they fund make a difference? They do, but we have to be able to show it. So please do work with us on collecting data. It's to justify the existence of the funding that you will benefit from. So there's something in it for you. And also let us know really good stories. Politicians, civil servants like numbers, politicians like stories, and ultimately it's politicians who decide whether we're going to fund these things. So great stories about what you're doing are very, very important in all of this. And then finally, join the community and be part of it. Champion what we do. Champion it with your colleagues, people in your areas of clinical practice, and then work with us on helping the next generation of people. In a sense, you know, you've benefited from it. Give that energy back to other people. And we have so many of you who participate in the panels, and you're brilliant at it in the sense that you see the issues and you bring your own experience of the interviews. And obviously, what we do is ask people to be involved in the process for those a little earlier in the pathway than you, because that's appropriate. So postdoctoral level, we're going to ask you to be involved in some of the doctoral stuff, and it's great experience. You see how panels think, see how panels operate, and believe me, you're going to find that useful when you meet a panel again in the future. And I hate to disappoint you, but you're never going to stop meeting panels for interviews. It's just the amount of money you're asking for increases over the years. So it is really useful to sort of get a close feeling about how it works. So help us to help you, and help us to help other people, because, as I said, it's an academy which is a community of people, and we can't emphasize the word community enough. Next one. And over to you, Amy.
Thanks, Dave. Hello, my name's Amy Brown, and I'm the NHIP Academy manager. Thank you for spending some of your morning with us. It's really great to see you. So the Fellows Forum is something that actually we were asked to do by our community. A group of our researchers came along and said, we want to meet more people that are clinical academics like us. And that's where the Fellows Forum came from. And really, it's a peer-to-peer support network. It's a way of bringing people together from different professions at different career stages, to be able to chat to people, build a community, learn from the person that's a step ahead of you, and try and help the person that might be that step behind. And we call it a Fellows Forum, but actually everybody is welcome. You absolutely do not need to be currently doing a fellowship or applying for a fellowship or have had a fellowship. If you're on that career development pathway, or you want to be, then you are part of our community. So we intentionally don't have a separate sign-up list or anything like that for it. Anything we advertise, you're welcome to. We started a series of Fellows Forums last year, and we ran them every month. Over the summer, we had a review of our offer, which our project manager, Holly-Ann, very kindly organised. And going from that, we've set up a new programme for the coming year, because it's really, really important to us that any events or training or any ask of you of your time is actually well used, and it's comes from what you would like to see happening, etc. So our new programme of events has started today. Coming next month, we have PowerPoint and Data, which is a session run by Duncan Yellow-Lees, which we ran last year and was very successful, and people asked for that again. The Art of the Fellowship presentation is coming soon. You'll see Dave and myself again, and some previous award holders there as well. So please just come along, be part of our community, tell us what you want, and we will listen and hopefully do what you ask. Dave, your hand's up, is that?
Yes, it was just to emphasise something you just said at the end, which is that this is a live programme.
Yes.
And we can, we're very persuasive at getting colleagues to take part in these things. So if there is a topic area we're not covering, which you think would be interesting and useful to yourself and other people, let us know and we'll pull some content together. And we've had some great suggestions about that. And there are certain areas that I think it's going to be very useful for us to sort of, continually run, but do come up with something new. We're always happy to do that and ask sort of colleagues to do that. So just give us a shout if you think there's something that would be useful to cover.
And then over to Nina, I think, please, Shan.
Thank you very much. Great to see so many people here, and especially great to see a lot of people from Northumbria University, because I think we're a bit newer reaching out to you, and that's very much on a target for us this autumn. So you're ahead of the curve, and thanks for joining us. I get the pleasure to talk about our successes, and these are very much, like Dave emphasized, this is community, this is collective success. And when you're part of it, you start to realize that it really is an ecosystem. But just to give you some highlights, so in the last 2 years, we've successfully supported over 65 researchers to secure personal awards, and these go across from the pre-doctoral to higher level postdoctoral fellowship awards. And there's some really exciting kind of new innovative aspects as well, where we've driven new training programs that have then been adopted nationally, and that's in connection to the medics program at the NIHR IAT program, the CR UK CAT with the Alzheimer's Society partnership, and then also the NIHR Insights program, which if you've been on social media, you will have seen the NIHR Insights adverts going out, and the roadshow is very much happening at the moment. And also some really exciting things where, I would describe it that we're helping people to break the glass ceiling. So Lorraine Harper on the Lorraine Cowley, not Lorraine Harper, who's at the NIHR Academy, easily mixed. We try to mix on all terms. So Lorraine, who got the first nurse nationally ever, got the MRC CARP award. We've also supported Flick to support the first NIHR Advanced Fellowship in Palliative Care. And then on the very first round of the NIHR Senior Clinical and Practitioner Research Awards, which we're debating over what's the acronym for that. I like to call it SCARPA because I think it's like SCARPA going up the mountains. But that was the first round with 80 awards nationally, and we helped colleagues across all the NHIP partners to secure 8 of those, which is just absolutely amazing, and really across disciplines. So I think that's important to emphasize as well. It's not here on the slides, but if another slide that we sometimes have is where we look at the size of the different pillars. And I think traditionally we used to think that it was always the medics who were getting all the juicy apples. But actually, when we look at that now, it's really, really activity happening across all of those 4 pillars. And probably where we're seeing most of the activity is in the methodology and in the public health. And we're having really exciting conversations with Northumbria University around the social care. So I think next year, this time, we're hopefully really seeing a lot of activity in that space too. So the overall NHIP Academy community is now over 500 researchers, and I think that's where we really see the massive impact. You know, and Dave said there, if there's a topic you want to have a talk or a fellows forum about, there is likely somebody in this community who can help to co-lead that with you, or you know, with anybody else, and we can make it happen. So yeah, it's super exciting. Dave, you've got your hand up. So, and I think I've only got one more slide. Do you want to go into that, and then I'll hand over to Dave?
No, I just wanted to add, while we're on this one, is that, you know, you don't want to pick out individual schemes, but another one was the EME Advanced Fellowship, which is a really big scheme from NIHR that allows people at postdoctoral level to combine a personal fellowship award with an EME trial grant. They're normally valued at around 1.5 to 2 million. First awards, 5 awards in that scheme, 2 to Newcastle, the only organisation to get more than 1. Both of our applicants were successful. So just another example of us kind of storming new schemes, and you know, that's a perfect example of a bit of intelligence about what's coming, allows people to think a little bit of it in advance of perhaps the you know, other organizations allow them to, so they're ready for this, so that they then put in the application. So it's just a really good example.
And that's and that's actually a really good point. You know, we all have a lot of conversations nationally with colleagues, and I think one thing that we are very good at in Newcastle is finding these new boundary spanning opportunities. We're very good at bringing 2 things together that actually maybe haven't been brought together before, and then just makes a really interesting proposal. So if you've got you know, you've got an idea, you've got passion, something that you're thinking about, and you think, it doesn't seem to quite fit, or I don't know which scheme it would go to. I think that's where we really come to our own, is helping you to think how to frame that, how to turn it around, how to sort of package it so that it goes from being the odd one to being the innovative one. And, you know, Amy's very good at that. Dave is very good at, I can help with that. So yeah, don't hesitate and think that you're somehow an outlier. And that brings us very nicely to the last slide, which I think, Amy, you should do, because Amy's got this perfect slogan about, you know, sofas, teas, coffees and biscuits. Absolutely. We're on in the Ridley building, just off Lovers Lane. Probably no more than 10 minutes walk from most of the buildings. So please do come and see us, come and say hello, come and have a chat. And Sharon, who can work the magic on the door lock, can give you the access forever for your rest of your lives.
And we have brilliant merch as well. So if you're ever in need of an umbrella, we have a range of umbrellas, mugs, lanyards, notebooks.
Water bottles.
Our umbrellas have become legendary and are appearing all over the country, and we're asking for photos of where they end up. So yeah, you can't escape from the branding. So I hope you found that informative. So obviously we're happy to take any questions. So either pop your hand up or pop them into the chat. Susanna, do you want to ask a question, or do you want me to read out? Susanna Carella. Cool. I'll do it. Okay.
Hi, I'm not.
Sorry.
I'm currently at the conference and the connection isn't great. So, if that would be okay for you to read it out for me, please, just in case I lose the connection. Thank you.
Yeah. So, two kind of linked questions. Would you be able to support applications that involve other host organisations apart from the North East? What about outside the UK? And would you be able to provide support to researchers currently at other host organisations, but that have previously worked at Newcastle? Okay, so I'll take those in turn. So the first is, obviously, nowadays, a very important part of this is thinking who are the best people to be working with. So we live in a sort of very connected world, and so it's very unusual actually for an application, particularly at a higher level, to go in that doesn't involve people from other organisations, be they collaborators or part of the training programme and so on. So there's a big world out there, and so involving other organisations is normal for people, and we can certainly guide on how you put that all together. It's important when you're looking at collaborating centres that it's not just high profile organisations. So sometimes you see people who are kind of working with Sir Bufton Tufton Nobel laureate, but they're not really involved in the project. They're there as a kind of name. So what they're looking at are people who are really good people to work at in that space and who will add to the project, give you sort of relevant experience. Just on that note, for training, certainly NIHR in particular, less so other funders, but to a degree, they really want to know what the training support program is like. So obviously at PhD level, it's supervision. At higher level, it's your mentors and sponsors, people who are really going to guide you. And they want to make sure that everything you want to do is covered by somebody who can help you with it. They don't want you to find out the hard way, working on your own. So making sure that your supervisor team, your collaborators covers all of the aspects is very important. And again, NIHR doesn't like you to be the only PhD student for somebody who's never supervised a PhD, and they don't want you to be one of 40 with a supervisor who's never going to talk to you. But if you have got somebody who's relatively new in supervision but really brings the skills, then have them as a lead supervisor. Perhaps a more experienced second supervisor will help guide all of that. So this is the sort of thing we do in, day out, that we advise about. What about people working elsewhere but have a link to Newcastle? Well, yes is the answer. I do that all the time. I've just helped somebody from Cambridge get a very nice fellowship. Why? We have a limited capacity ultimately, but fundamentally we're training people and we want to support people to be successful in what they do. Fundamentally that's why we do it. It's not about the organization. It's certainly not about papers and things for us. It's about doing the right thing, and so we want to do the right thing. Some link to Newcastle clearly is important, but if somebody has links here and is now somewhere else, we can give advice, of course we can, and the kind of payback for that is to tell everybody what a brilliant place Newcastle is if they're thinking about where they go for their training. So in training world, anybody will know that the biggest compliment I can ever pay anybody is that person's a training person. By that I mean they put the interests of the individual above their own interests, the interests of their organization, and we do that day in, day out, because that's the right thing. So of course we're happy and keen that people who've been linked to Newcastle go on to be successful, but we have a sort of limited capacity, so there's a common sense element to it. But sure, I've done that. It's easier perhaps for me to get involved in that than Amy, who's much more hands-on with the grant submission process here. So I'm at the more philosophical end of the spectrum. That might not surprise you, having heard me talk, but certainly guidance like that. And I mentor people all over the country in all manner of disciplines, just because they've asked me if I can give them some guidance. I'm a training person. It's what I do. I hope that I hope that's useful. Paulina, are you able to pitch your question, which I think is a very relevant one? Or do you want me to?
Hi, yes, I'm a basic scientist working in kind of translational setting. So I wonder if you would support a person who is not a clinician, and whether you would support application to the funding bodies that are not kind of clinically focused, such as Wellcome Trust or BBSRC.
Yeah.
Thank you.
Okay. Amy, do you want to take that one, and I'll add some comments afterwards?
Hi, Paulina. We try and help everybody, and you're certainly welcome to our Fellows Forums, our events, our Know Your Funders, etc. And any expertise or knowledge we have of the funders will certainly help you with. If you're in Newcastle University, currently the funding development team are the best place to go to for advice on basic science funding development and fellowship applications. And there's a career route there at the minute, but we all get on together and we're all part of the same team in the broader system. So we always help each other. Do you want to add anything, Dave?
Yeah, can I add to that? So the part of the kind of bit that works with what we do is the extent to which you understand the system inside out and the ecosystem inside out. And one of the kind of things that we're less good at is understanding schemes outside our area of expertise. So you mentioned Wellcome Trust. Well, we work with Wellcome Trust on various different things. MRC, we work with MRC, but we have no experience of BBSRC or Royal Academy and so on and so forth. So that's where the funding development team and the faculty have the right expertise, and it's getting that fit for the right person, the right scheme. Now, a lot of our educational stuff and activity is very generic about, how do you pull a fellowship together? All fellowship funders have the same thoughts about training and capacity building. So much of the Fellows Forum activity is highly relevant. There is a really interesting part to this, which, and you said working in translational research, which is that there is a movement going on at the moment, which is that sort of historically, the kind of medics, the scheme supported medics to go off and do laboratory science, and that was a traditional way of doing things. But there was never really the equivalent for people doing laboratory science to get relevant clinical experience. And the point about that is, in translational research, there are really important concepts about what you need to do to develop a therapy or a diagnostic test where you can build those things in very early. So we talk about, we think about laboratory research for clinicians, but we don't think about clinical research for laboratory scientists. And this is a discussion that's being had nationally about, are there some opportunities here? Now, in Newcastle, we benefit from some exceptionally good people in that space. So I think to do with the history of the organization, we've got some people who are laboratory scientists who really get this side of it. So it's a really exciting area, and this is to encourage you to bring your science, laboratory science discipline and think about those translational aspects. And there are some schemes that are well worth thinking about, like, for example, MRC experimental medicine, which are really in this space. So actually, there is our world started as clinical, but as anyone will tell you on the methodology side and, epidemiology and so on and so forth, actually, we've gone well beyond, people with a clinical role. That same applies into translational research. And I have a feeling that a big expansion area over the next few years will be in this area of supporting people with a very robust laboratory science background to go into the more translational aspects. And there are, as I said, some very, very good people in that. One thing worth saying is that if anybody is interested in taking basic science concepts into people, MRC experimental medicine is an undersubscribed and very exciting scheme. And Ruth Plummer, who many people here will know, is the chair of that panel and gives fantastic guidance about that. So yes, a lot of what we do is relevant. There are other people who can get very involved in all of that and look for these interface schemes. There's a common theme here, which is schemes that bridge gaps between previous disciplines that kind of didn't work together, represent a real opportunity area. And that's where I think we've been really successful. Nina.
I completely agree. And I think what Dave is saying there really beautifully illustrates that point, that actually you might currently think yourself as in this box, but if you go to the Fellows Forums, you speak to this community of people, you may be on the back of that learning and thinking and following your own leads, you decide, actually, I'm going to need a quick chat with Dave or Nina or Amy about my idea. And you might come to think, because you said basic science, but you also said translational. So actually it's about ultimately how does this thing take shape? And you often don't know that at the start, but going around speaking to people really helps you to polish that diamond.
And one thing literally Amy and I were talking about this morning and have been talking about is opportunities in drug discovery, okay, which is an obvious area for where basic science, laboratory science rapidly becomes translationally relevant. And we've got, again, as people will know, some absolute stars in this space, fantastic in the training space as well. And we're interested in developing the opportunities, and we are thinking of pitching that to one of the funders as a potential scheme. So we're live to all of these things, basically breaking barriers down so that people who have experience in different disciplines allows them to communicate across the barriers between those disciplines that makes it all work. And you know, I came up to Newcastle in 1988 and strangely sort of never seemed to leave. So I've taken the long view here, and my experience of here, that there are two abiding things that I think we do really, really well. One is we bridge those gaps in a way that other organizations that I've kind of worked with don't, very much siloed. People don't talk to each other. This concept of spanning across it is something that we're very good at, but we don't, maybe perhaps don't realize it because we don't see it elsewhere. And then the other one is the commitment of the organizations and the people around career development, you know, the stuff we're talking about today, where we are kind of pioneers in all of that. So if you are interested in building your career in something that spans disciplines, this is the right place to be, basically. Oh, right. Oh, lots of, oh my gosh, lots of more questions. So timescales. So comment about the SCPRA. I call it SCOPRA rather than SCARPA, but it's kind of, you know, I say potato, you say potato. SCOPRA is a great scheme, okay, and I think we, and this is a massive credit to Nina and Amy and colleagues who really have mastered this. And in fact, I think, you know, I won't embarrass Amy, but she's giving guidance to NHR on how they run their scheme, which is just how we want it to be. So this is a great scheme, and you know, as I said, we had a number of exceptional applications, and that was noted nationally. And for anybody, if there's anybody on the call who was kind of involved in one of those applications, that message, you know, what we've heard back from the panel, and Nina can confess that she's on the panel, is that that messaging, oh God, here's another one from Newcastle, that's another fellowship we're going to have to give. Do you know what? That's money in the bank, literally money in the bank, because the next person that comes in from Newcastle, that feel good carries forward. And I've seen that work, you know, on panels many, many times. Very high quality, very focused in areas, and really distinctive. So I would like to say that I think our applicants to SCOPRA, notice potato, our sort of range of applications is what actually made that scheme work, because they were so diverse in background and area, but all incredibly professional. And a number of them were trust colleagues who had been research trained and for whatever reason had gone back into full-time clinical practice, but still wanted to do this and be interested and you know, still had the questions that came from their clinical practice. And this was just an opportunity for them to do that, which is why it was so good to do it. Now, obviously, in terms of timescales, the earlier the better. Okay, so it takes 6 months to develop an application. So it's very important to kind of be aware of when the deadlines are. The longer the better. It's the last 10% that makes the difference. The polish. just to say in general terms, never ever underestimate the importance of really professionally put together applications. Sloppy applications equal sloppy science. I always remember in the old days when there were paper submissions, I was asked to referee a grant where somebody had put the protocol together and they'd left the track changes in. Nobody had even leafed through it and looked at it. And in the protocol was a track change saying from the supervisor saying this is crap, and they hadn't corrected it. Well, what am I going to think as a reviewer, right? So really nicely put together, get somebody to read it, to make sense of it, help the reviewers. Professional production equals a sense it's going to be professional science, and that takes a little bit of time. For somebody submitting a PhD in these professional areas, there are so many opportunities now. It's worth a conversation with Annette or Nina or Lindsay in that pillar. If you're from an NMAP background, just to think about what the opportunities are. There has never been a better time in terms of the schemes that are available. There are, at least 3 instantly without knowing anything else, but it's worth thinking about which is the right one for you. And they have nuances, and it's therefore worth thinking about it. But again, we've got a lot of expertise with it. Obviously, deadlines are dictated by the funder. When they do, then watch out for schemes that are 2 or 3 times a year. Depending on the funder, some schemes are once a year, and you have to work out, which is the best one. But don't leave it to the last minute, because that means you end up having to compromise. Nina, is it secret you're on the panel? No, it isn't. Is it?
No, I think it's public knowledge. No, completely. And just to really emphasize that, so last year it was the day after the panel on which both Annette and I were on, that Annette and I had a conversation, right, who are we supporting to the next year's competition? So, and I think we have these now for all the levels. For the pre-doctoral awards, we don't quite follow people up for a year, but we certainly kind of collate a list, and probably about 5 to 6 months before the deadline, we expect to have a fairly comprehensive list. And if people pop up after that, it can make things quite difficult. But the postdoctoral awards, especially because most of them are across multiple organizations, that in itself takes months and months of negotiations and planning and sort of, as Dave would say, how do you choreograph that? So 12 months in advance is definitely not too early. That's a perfect time to get involved with the community, start having chats with people, and then about 6 months before deadline, you should definitely make sure that you're on our shortlisting. For the professorial awards, it's a 2, 3, 4 year waiting list before submission, Dave.
Something like that. And just please, where you are, have a clinical role as well as a research role, and that's what you want to do moving forward. Please work with your clinical employer as early as possible with all of this. As I say, the essence of NHIP is that it's all the organizations working together, but they have to staff clinical units and things like that. And we do have a very good relationship, but it's a relationship we work at on both sides. So everyone with a clinical life as well as a research life has other obligations. For the medics who are still in training, it's with the deanery and out of program and all of those. For people from an NMAP background where you've finished your clinical training or in clinical practices about configuring services and all of that. So early discussions, and where problems arise, it's where somebody drops a bombshell a few weeks before they want to do something. So it's about fair dealing with everybody. Right. Any more questions from anybody? Any other last comments from Nina or Amy?
No, I think just get involved. It's a lot of great fun. There'll be more friends in the system than you've guessed. That you'll meet a lot of familiar people. You meet a lot of new people. Just get involved.
Amy, any last comments from you?
Looking forward to meeting you and working with you.